Something's wrong. My heart won't slow down. I can't catch my breath. My chest hurts. My hands are tingling. I'm getting dizzy. I think, am I having a heart attack? Am I dying? This isn't a heart attack. This is what a panic attack can feel like. And in today's video, we will be talking all about panic disorder, what it is, why it happens, and how people recover. Panic disorder is one of the most misunderstood anxiety disorders because it can feel incredibly physical. Many people experience their first panic attack and end up going to the emergency room believing that they're having a heart attack or other medical emergency. The good news is that panic disorder is highly treatable. In this video, we'll look at what panic disorder is, how it's diagnosed, why panic attacks happen, and evidence-based treatment that helps people regain their lives. Everyone experiences anxiety from time to time, but panic disorder is different. A panic attack is a sudden surge of intense fear or discomfort that reaches its peak within minutes. During that time, your body reacts as though you're facing a life-threatening danger, even when you're actually safe. Panic disorder develops when someone begins having repeated, unexpected panic attacks and then starts worrying about having another one. That worry often changes behaviors. People may stop driving, avoid stress, refuse to exercise, or only go to places where they feel safe. Anyone can develop panic disorder. It affects men, it affects women, teenagers, adults, regardless of personality or background. According to the DSM-5-TR, panic disorder requires recurrent, unexpected panic attacks. After at least one of those attacks, the person spends a month or more worrying about future attacks or changes their behavior because of them. That behavioral change is important. Imagine someone who stops going to the grocery store because they're afraid of a panic attack in public, or someone who refuses to drive on the freeway after having a panic attack while driving. A diagnosis also requires that the symptoms aren't better explained by medication, substance use, or another medical condition, or another mental health disorder. In other words, clinicians want to make sure they're treating the correct problem. Panic attacks involve both physical and emotional symptoms. Physically, somebody may experience a racing heart, chest pain, sweating, shakiness, dizziness, nausea, or a shortness of breath. Emotionally, they often experience overwhelming fear, feeling detached from reality, or the terrifying belief that they're about to die or lose control. Imagine standing in line at the grocery store when suddenly your heart starts pounding, your breathing becomes rapid, your vision narrows, you think something is terribly wrong. To everyone else, you may look completely normal. Inside, however, it feels like your body is sounding an emergency alarm. The panic cycle is one of the most important concepts in understanding panic disorder. It usually begins with a harmless physical sensation. Maybe your heart starts beating a little faster because you climbed up some stairs. Or maybe you feel slightly lightheaded because you skipped lunch. Most people are just going to ignore these sensations. Someone with panic disorder, however, may think, oh, something's wrong with my heart. I'm about to faint. I'm losing control. Those thoughts create fear, and fear activates the body's fight-flight response. Now the heart beats even faster. Breathing becomes even quicker. The dizziness increases. The symptoms seem to confirm the catastrophic thought. The cycle feeds itself until it becomes a full-blown panic attack. Understanding this cycle is one of the first steps towards breaking it. Why does a panic attack feel like a heart attack? Well, during a panic attack, your body releases adrenaline. Adrenaline prepares you to fight or run away from danger. Your heart pumps faster to move blood towards your muscles. Your breathing speeds up to bring more oxygen. Muscles tense, sweating increases to cool your body off. All of these reactions are completely normal during a real emergency. The problem in panic disorder is that the alarm system activates when there isn't an actual threat. The symptoms are real, they're just being triggered by a false alarm. Avoidance behaviors. After someone experiences a terrifying panic attack, it's natural to want to avoid having another one. Unfortunately, avoidance often makes panic disorder worse. Someone may stop driving because they had a panic attack on the freeway. Another person may avoid crowded stores. Others stop exercising because the increased heart rate they get from it reminds them of a panic disorder in the past. Over time, life becomes smaller and smaller and smaller. In some cases, people develop agoraphobia, a condition where they become afraid of places or situations where escape might be difficult if panic occurs. Treatment helps people gradually reclaim those parts of their lives. There isn't one single cause of panic disorder. Instead, it develops through a combination of biological, psychological, and social factors. Genetics can increase vulnerability. Differences in brain chemistry and the body's alarm system also play a role. Psychologically, some people become highly sensitive to normal body sensations and interpret them as dangerous. Social factors like chronic stress, trauma, or major life changes can increase risks as well. Think of panic disorder as several puzzle pieces coming together, not one single event causing the disorder. Risk factors. Certain experiences can increase the likelihood of developing panic disorder. A family history of anxiety disorders may increase vulnerability. Chronic stress can keep the nervous system on high alert. Trauma, major life transitions, or living with another anxiety disorder may also contribute. It's important to remember that having risk factors doesn't mean someone will definitely develop panic disorder. It simply increases the likelihood. Now let's talk about how panic disorder is diagnosed. Mental health professionals like myself diagnose panic disorder through a detailed clinical interview. They ask questions about your symptoms, how often they occur, what triggers them, and how they've affected your life. They then compare your symptoms with the DSM-5 TR criteria. Because panic attacks can resemble medical problems, healthcare providers may recommend ruling out conditions like heart disease, thyroid disorders, or certain medication effects. Sometimes standardized questionnaires are also used to help measure symptom severity and monitor progress throughout treatment. Treatment. The encouraging news is that panic disorder responds very well to treatment. Cognitive behavioral therapy helps people recognize and change the catastrophic thoughts that fuel panic. One of the most effective techniques is called interoceptive exposure. This involves intentionally creating harmless physical sensations in a controlled environment. For example, a therapist might ask someone to spin in a chair to create dizziness, or maybe run in place to increase heart rate, or breathe through a straw to mimic shortness of breath. At first, it sounds a little strange, but the goal is to teach the brain that these sensations are uncomfortable, not dangerous. Exposure therapy also helps people gradually return to avoided situations like driving, shopping, or exercising. Some people benefit from medication, particularly SSRIs, especially when combined with therapy. Relaxation skills, grounding exercises, and healthy lifestyle habit changes can also support recovery, though they're most effective when used alongside evidence-based treatment rather than as the only strategy in place. Living successfully with panic disorder. Recovery doesn't mean you'll never feel anxious again. Anxiety is a normal human emotion. Recovery means learning that panic is not dangerous and no longer allowing it to control your decisions. Many people return to traveling, exercising, giving presentations, shopping alone, and doing the things they once avoided. Regular exercise, quality sleep, mindful practice, supportive relationships, and consistent therapy all contribute to long-term recovery. The goal is not to eliminate anxiety. The goal is to build confidence that you can handle it. Panic doesn't define you. Many successful people have openly shared their experiences with panic attacks. Adele, Emma Stone, Christian Bell, Amanda Seyfried. Their stories remind us that panic disorder can affect anyone. It doesn't define intelligence or strength, nor success or character. Like any medical condition, it deserves understanding, compassion, and appropriate treatment. Recovery is possible, and millions of people go on to live full, meaningful lives. One of the biggest myths is that panic attacks are heart attacks. While the symptoms can feel remarkably similar, Panic attacks are caused by the body's alarm system, not by blocked arteries or a failing heart. Another myth is that panic attacks are physically dangerous. They are certainly frightening, but the symptoms themselves are not harmful. Understanding what's happening inside your body often reduces fear and becomes an important part of recovery. Supporting someone with panic disorder. If someone you care about experiences panic attacks, your response matters. Stay calm, listen without minimizing their experience. Instead of saying, just relax, try saying, I'm here with you, you're safe. Encourage slow, steady breathing and remind them that the feeling will pass. Support them in seeking treatment, but avoid rescuing them from every feared situation. Recovery often requires gradually facing those fears. Finally, celebrate progress. Even small steps deserve recognition. When to seek help. If panic attacks are happening repeatedly, causing you to avoid situations, interfering with work or relationships, or creating significant distress, it's time to seek professional help. Many people wait months or even years before getting treatment because they think they should simply push through it. You don't have to. Panic disorders are one of the more treatable anxiety disorders, and help is available. Let's review the most important points. Panic attacks are real. Panic disorder is highly treatable. Recovery is absolutely possible. If you'd like a quick reference, you can download my free panic disorder educational handout from my Shopify store. And if you enjoy evidence-based mental health education, be sure to follow The Quiet Mind for more videos covering mental health diagnoses, DBT-informed coping strategies, psychology, and evidence-based treatment. Thanks for watching, and I'll see you in the next video.